So I want to talk a little bit about the nature of the recovery. So a lot of people ask me, what's the recovery like? So one is pain. Oftentimes my patients don't have very much pain. It's not that uncomfortable. Rarely, this morning I had to do it. A lady had some discomfort back here from yesterday. I just put some Botox in, believe it or not, knocked it out. I do that once or twice a year. I mean, it's very, very uncommon to have to do that. But my FUT strip procedures just don't hurt very much. It's not like what other places have where it's very uncomfortable afterwards. It really should not be the way that I do it. And I can spend an hour telling you about why that is. And if you have a question, I'd be more than happy to elaborate on why that is when you come in and see me. But in terms of the recovery, bruising typically should be almost none. I don't rarely see bruising. Swelling, only about 15%, 15% of my patients have swelling. That swelling lasts usually about 3 to 5 days. In rare cases, it can last 7 to 8. And again, 85% of my patients don't even have the weird swelling. If you have the weird swelling, just wear sunglasses, will cover it up for the first few days. Scabs are the biggest offender. You're gonna see weird scabs up here where I transplant. If you can have a hairstyle that can cover it, that's great. That would be really, really wonderful. And wearing the hairstyle will be able to cover the scabs until you can rub them off. The scabs are rubbed off in 7 days. And so that makes the recovery not so bad. The backside incision is pretty much hidden. You're not gonna see that even walking out of my office. So in terms of social contact, if you can cover this here and you don't have much visibility, it could be a day out. If you may have to wear a scarf or a baseball cap or something or a hat to cover it for that week. And that could be the nature of the recovery. Stitches come out about 2 to 3 weeks after the procedure. You don't feel very much discomfort with that, but it's pretty fast. In terms of going back to working out, I say listen to your body. Don't force yourself. Don't go crazy. Don't push yourself. The only thing is, you can shower 24 hours out after the procedure, a day afterwards, but no tub bathing where you're under the water or swimming for about 6 weeks. So I don't want you to be in dirty water if possible. The other things is traumatic sports. Nothing that can, impact, karate, something that would, hit you. That's about the only thing I would say. I wouldn't want that for about 6 weeks or so. Otherwise, in terms of just general working out, just listen to your body. And that's really what I would advise. In terms of when the grafts grow in, I've seen as early as 4 months, but honestly, it's oftentimes about 5, 6, 8 months that you start getting a good expression of things. And remember, women need oftentimes longer hair, and it only grows about 1 inch a month. So over time, it gets longer and longer and longer and longer, and so that full expression may take a year. But a lot of my female patients are quite happy between 5, 6, 8 months, but they're really full expression maybe 12 to 18 months out. Do you need a second transplant? My goal after one surgery is to get you done. But some of my patients come back and say, could I have a little more density here or there? And I would usually like to wait at least a year so that we let the hairs grow in, and then what you thought at 6 to 8 months you needed another surgery, you don't need it. And so I always encourage my patients to wait before we rush back to do another surgery. And plus, I want all the donor area to heal as well, too. And the reason I think my patients get such amazing results after a single session is, first of all, it's my design. It's obviously the protection of the grafts. It's also my staff, how good they are in terms of placement. They do amazing work. And then finally, it's the ATP hydrothermosol PRP and A cell, which are a mouthful to describe fertilizers, because the hairs have these great fertilizers that allow the hairs to grow better during the transplantation process. So I hope this video gives you a very large overview of everything you need to know about female hair loss and hair restoration from medicine to surgery.